Hi, my name is Adolfo Sanchez-Blanco and I'm one of the biology professors at Capital Community College. In this series of videos, we are discussing various scientific insights into COVID-19. In this video in particular, we're going to talk about who is more at risk of developing more severe types of symptoms in COVID-19. All right, so the first thing that we have to remember, which we explained in previous videos, but I will review this again, is that when a person is infected, various outcomes can be possible. And these various outcomes can be very different with respect to each other. Like, for example, up to 50% of all the people that get infected will start incubating the virus, but eventually they will recover from the virus without having experienced any types of symptoms or whatsoever. This is what normally are referred to as asymptomatic carriers of the disease. All right? Now, the rest of the population that gets infected with the virus will eventually show symptoms of the disease. All right? And now, about 80% of the people that show symptoms will show relatively mild symptoms, and then they will recover from these mild symptoms in about 10 days or so. But a significant percentage of people will get far more severe symptoms. Like, for example, about 20% of all the people that experience symptoms may require some degree of hospitalization, right? And from those that get hospitalized, 20% to 25% of these people would eventually require going to the intensive care unit. Right? And as I explained in previous videos, up to half of the people that go to the ICU may die, unfortunately. All right? So the big question is, what is it that makes certain people go through this viral infection with no symptoms or whatsoever, whereas other people may experience the disease with some mild symptoms or very severe symptoms that in many cases can lead to the death of the individual? This is a very big open question, and we're going to try to tackle this question to some degree. All right? So one factor that seems to be very important is the viral load. All right, so what are we talking about when we talk about the viral load? What we're talking about basically is the amount of virus particles that a person is exposed to when he's infected. So, for example, if a person is infected or exposed with a relatively low viral load, these people are believed to may go through the disease in either an asymptomatic way or a slightly symptomatic way. All right? So this could be one of the explanations for why certain people would maybe experience a disease in completely different ways, because what it has been observed is that if people are exposed to a high viral load, these people have a higher probability to develop more severe symptoms that in many cases can lead to hospitalization and intensive care unit needs, and ultimately in many cases the death of the patient. All right? So this is one of the explanations for why these big question marks over here. Right? But this is not the whole picture of why certain people may go through the process of infection in a totally asymptomatic way, or certain people may go through the process of infection in a far more severe way. All right? So there are other circumstances that contribute to these question marks. All right? Like, for example, it has been observed that the age of the patient and the sex of the patient are super important factors. For example, if we just focus on the statistics, and by the way, these are statistics that are based on a nationwide French study that was published very recently. So if we focus just on the overall statistics, you can see that the overall number or percentage of hospitalizations from all the infections that are experienced in the whole country of France are about 3.6%, or that the number of deaths from all the hospitalizations are about 18%, leading with an overall percentage of death relative to all infections, or a mortality rate in the whole country of France that is around 0.7%. This is an aggregate, these all aggregate numbers. When you dig into these numbers and you break them down by age categories, the numbers are remarkably different, all right? And I want you to appreciate this. I want you to appreciate the fact that the older that the patient is, the bigger the risk for the patient to develop COVID-19 in a much more severe way. All right? Like, for example, you can compare that people that are beyond 60 and older have a much greater risk of hospitalization if they get infected, or a much greater risk of death if they get hospitalized, or an overall greater mortality rate when they get infected. All right? So this is a very important factor, because it is not the same to compare the risk of a person that is younger to develop a much more severe form of COVID-19 than a person that is older. All right? So definitely being older is a much bigger risk factor when it comes to the severity of COVID-19. The other thing that is very interesting is that for all age groups, it has been observed that males have a greater probability of hospitalization, ICU visit, and death than females. Right? The cause for this is unclear. It may have to do with health habits, but it doesn't look like it's a whole picture of why males are more at risk of severe forms of COVID-19 than females. But the fact that is that this is our reality. All right. Now, the other thing that is interesting is that this higher risk of males and females for hospitalization, ICU, and death in all age groups is independent of the probability that they have to get infected, because what we know now is that males and females are equally susceptible to be infected by the virus that produces COVID-19. All right. Now, so we know that the viral load is a factor. We know that the sex and the age of the patient is a factor, but this is still not the whole picture. There are other factors that contribute for the probability that the patient will experience the disease in a mild way or in a much more severe way. Like, for example, having chronic health conditions seem to be a very important issue as well in determining whether a patient may go through the process of the disease in a mildly symptomatic way or in a much more severe symptomatic way. All right? Like, for example, look at these statistics in which the 5 most prevalent conditions, health conditions, that predetermine the severity of COVID-19 are outlined here. All right. So what you can see is that in this graph, what you can see is that, for example, about half of the patients that get hospitalized in the United States have already hypertension as a chronic health factor, right? Or half of the patients that need to get hospitalized are also obese. All right. So these are 2 of the most important or most prevalent health conditions that are observed in patients that need hospitalization in the United States. The other detail that is super interesting in here is to realize that about 90% of all the people in the country that get hospitalized have one or more underlying conditions from this list, or this is a partial list because there are other conditions. All right, so this is remarkable because it shows that having a chronic health condition or more than one chronic health condition puts you in a very high risk factor to have a much more severe form of COVID-19. Now, the final thing that I wanted to emphasize in this video is that COVID-19 is really not like the flu when it comes to the severity of the disease. Right? And you can make a very easy comparison if you want to really compare the flu with COVID-19. This comparison is to just check the number of deaths that have been experienced or reported in the last 10 years for different various flu seasons. And what you can see is that the worst flu season that we have experienced in the last 10 years was the season of the 2017 to 2018, in which about 61,000 people were reported to have died as a consequence of the flu. All right, and this is for the entire year season of the flu. Okay, if you compare that number, the worst flu season, with COVID-19, you can see that in COVID-19, in about 4 months, more than 100,000 people have died. This is in 4 months only, and this is with the aggressive contention measures that have been put in place that have, as you are aware of, devastated the economy. But what I want you to see is that how dramatic that change in lethality has been in just a matter of days. We're not talking about the whole season like in the case of the flu season. We're talking about just days. You can see that in a matter of 70 days, we have gone from the first 100 casualties due to COVID-19 to more than 100,000 deaths in just 70 days, and with all the efforts that the different states have been putting into place to avoid a full-fledged pandemic. Okay? I want to also show you this graph just to show you that the COVID-19 is really not like the flu. In this graph, you can see the weekly deaths reported for COVID-19 in the city of New York, and it is compared here the weekly deaths for all other causes or for the worst flu season that was experienced in the last 10 years. And what you can see is that it is overwhelmingly incredible the amount of weekly deaths that were seen as a consequence of COVID-19 compared to all other causes of death in 2017, 2018, when the worst flu season was experienced. All right. So in summary, we were trying to understand the question of who is at risk for more severe forms of COVID-19, and we have talked about how the viral load plays an important role in the severity of COVID-19, and we have talked about how if a person is older, or if a person is a male, or if a person has chronic health conditions, all these are important factors that increase the risk of COVID-19 hospitalization and death. And we have stressed the point that COVID-19 is really not like the flu. It's a much more severe disease.